All nursing homes are supposed to report their COVID case count and deaths to the state every day. But over the past year, a surprising number show up as reporting no data at all. In a year when lack of transparency has been such an issue with these facilities, some are questioning whether we can trust the numbers. So many people died of COVID in Pennsylvania nursing homes over the past year, more than 13,200 by the state's official count.
It took 6 days for her to die, from the day they told us that she had it to when she passed. 6 days, my twin sister was gone. This is me, that's Laura, that's me.
Lynn Campbell's twin sister, Laura.
We loved each other so much.
Just 56 years old, Laura, a resident at UPMC Seneca Place, died of COVID in December, in her sister's arms as she played her favorite song on her phone.
And I just crawled, around her and held her until last heartbeat beat.
Pennsylvania has one of the highest death rates for COVID in nursing homes in the country, coming in at number 5, more than states with even larger populations like New York, Florida, and California. Every person who dies of COVID in a Pennsylvania nursing home is supposed to be counted and reported publicly here on the State Department of Health website. But as I reviewed spreadsheets downloaded over the past year, month after month, missing data was reported from dozens of facilities. That number peaked in January of this year, with more than 400 facilities reporting no data. That's more than half of the state's nearly 700, about 80 of them right here in southwestern Pennsylvania. That included several Kane nursing homes run by Allegheny County and UPMC-owned Seneca Place, where Laura lived. More than half of the facilities reporting no data.
How can they do that? How can that be allowed? The public has the right to know everything about this COVID, everything. And especially if they want to put a family member in a home.
What you see in many places is no data, no data, no data. State Representative Natalie Mihalik of the South Hills has been critical of the state for its handling of nursing homes during the pandemic, but even she was surprised to see so much missing data.
There's facilities on there that you're looking back almost a year and they've never reported any data. How is that even possible?
I'm trying to get to the bottom of who was behind that decision and why.
Mihalik's rigorous questioning of the state health secretary in February led to an ongoing investigation of nursing home deaths in the state, and now she wants to see more accountability for missing data. Do you think they're being lax in their regulation and holding them accountable?
It's very lax. How would you feel if you had a family member in any of these facilities and you have no clue what's going on in there?
And there you have all the facilities, no data. We asked the state why this hasn't been fixed. In emails to 11 Investigates, the state blamed nursing homes for the problem, saying they reported either no data or inaccurate or incomplete data. And they said they have worked with facilities on the importance of data reporting.
That really is a challenge.
We first asked then Health Secretary Dr. Rachel Levine about this in August after noticing missing data more than 9 months ago, wanting to know back then why more wasn't being done about it.
Some of the families feel like facilities are trying to keep COVID outbreaks secret.
I can understand certainly the families' concerns. In the end, if we have to be more punitive, we will. But that's not our goal.
Yes, hi, this is Angie Moreski calling from WPXI Channel 11. We called 24 local nursing homes shown as reporting no data. You definitely report all data? Oh. Several insisted they do report their data and didn't realize there was a problem.
We put our numbers in every day.
Executives from Quality Life Services, which owns 10 area nursing homes and appears several times as reporting no data, told us no one from the state contacted them about it.
I think it's concerning if it's showing no data and we know data has been submitted. I think it's also unfair to consumers and to the providers that are relying on this data to be accurate.
Just how inaccurate are these numbers? Taking a look at the state's latest public data and hitting auto sum under the number of resident deaths, it adds up to fewer than 7,000 compared to more than 13,000 for the state's official tally. But since data is missing, we don't know where those additional deaths occurred or how the state reconciles its numbers. Do you trust these numbers?
No, honestly, Angie, I don't know. I don't trust it at all.
For Lynn, it's personal. She's demanding more transparency.
I want things to change. I don't want to see my sister's death be for nothing.
Now, since we contacted Seneca Place, the home where Lynn's sister lived, their numbers did show up in the data reported this week. But there are still more than 200 nursing homes statewide showing no data. It's not clear why the state hasn't done more to fix this problem after all this time. We've been asking for an interview since last week, but they have yet to make someone available. It seems, though, we are getting their attention. In another email just yesterday, they told me the state is now considering some changes as early as next week to help improve nursing home compliance. We'll follow up and hope to find out what that means for the public when they talk to us. Angie Moreski, 11 Investigates.